Hello everyone, I am Dr. Shankar Dey. This is third session of INI-CET 2021 November questions recall session. So coming to the question number 21. So those who have not watched my previous two videos, first go through previous two videos, then come to this video. So starting with question number 21. Which part of scapula is palpable in infraclavicular fossa? So part of the scapula which is palpable in infraclavicular fossa. Answer for this question is this part. This is nothing but coracoid process. So this is repeat question from M's previous year question, anatomy part. So coracoid process, this part is palpable in infraclavicular fossa. Actually in today's exam the area, four areas are marked in the scapula, like this is A, this is B, this is C, this is D, like that four areas were marked. I forgot the exact location. Actually this and this area were marked and other two areas, and the question asked which part was palpable in infraclavicular fossa. So the answer is this part. I think the option B, this part, coracoid process is palpable in infraclavicular fossa. So coming to the question number 22, which of the following is not a long and reversible method of contraception? The question asked is which is not a reversible method of contraception. Among the four options, one of the option was laparoscopic sterilization method, laparoscopic tubal sterilization. So this is permanent method. Actually this is considered as permanent method, and other options were like levonorgestrel 20, copper T. These devices, implanon, these are temporary devices, but these are reversible, but not reversible is laparoscopic tubal sterilization. So this is the answer for this question. Next, coming to question number 23. If outer sheath of a nerve fiber is intact, so outer sheath of nerve fiber is intact and axon, inner axon is damaged, then this is known as axonotmesis. As axon is damaged but outer sheath is still intact. And what is neuropraxia? Neuropraxia is nothing but physiological dysfunction of nerve, where all the layers are intact, only the physiological block of function occurs in neuropraxia. In case of axonotmesis, the inner axon is damaged but outer sheath is intact. In case of neuronotmesis, both axon and outer sheaths are damaged. Coming to the question number 24. Pacinian corpuscle required dash for its activation. Touch. Pacinian corpuscle is specially made for this sensation. Pressure, sorry, not touch, pressure. So the answer is pressure for this question. Coming to the question number 25. In which of the following disease collagen is affected? See the question, collagen. Among the options, the answer will be scurvy. As you all know, vitamin C is required. Vitamin C is required for collagen formation. So vitamin C deficiency hamper the collagen formation, that cause scurvy. Presence with spongy gum, gum bleeding, pseudo paralysis, hemorrhage, petechiae, etc. So scorbutic rosary. So these are the features of scurvy. In case of rickets, there is no defect of collagen formation, rather there is bone maturation defect. So I forgot the rest two options. So the answer of this question is scurvy. In scurvy, collagen formation is affected. Next, question number 26. Identify the wave of JVP that is caused by isovolumetric contraction. So isovolumetric contraction की वजह से कौन सा wave form होता है? So the answer for this question is C. So wave C of JVP is formed because of isovolumetric contraction. See, these are the wave of JVP, like this is A, C, then X, then V, then Y. See, A, C, X, V and Y. A, C and V, these are the upward waves, and X, Y are downwards wave. So A, this A occurs because of atrial contraction. So A wave is due to atrial contraction. This C wave is due to this question, isovolumetric contraction, because of bulging of tricuspid valve with isovolumetric contraction. This downward deflection X is due to atrial relaxation. So atrial relaxation causes X wave. Then V is due to atrial filling. After atrial relaxation, it is followed by passive atrial filling that causes wave V, and this Y wave is due to atrial emptying, atrial emptying with opening of tricuspid valve. So these are the JVP waves. So isovolumetric contraction produce C wave in JVP, which does not potentiate the gastric acid secretion. As you all know, histamine, gastrin and vagus nerve stimulation or acetylcholine, these three substances usually potentiates or increase gastric acid secretion, but this serotonin is not responsible for increased gastric acid secretion. So the answer is serotonin here. Here the answer is serotonin. So serotonin is not responsible for increased gastric acid production. Next, splenomegaly is not seen in hairy cell leukemia, in CML, in Hodgkin lymphoma. Splenomegaly is seen, but in case of aplastic anemia, splenomegaly is not seen. So in case of lymphoma and leukemia, splenomegaly is usually seen. And as you all know, CML, chronic myeloid leukemia, is characteristic features is massive splenomegaly, and in case of lymphoma leukemia also splenomegaly is seen, but in case of aplastic anemia, splenomegaly is not seen. Next, third part of vertebral artery. So vertebral artery, third part passes through which structure? One image was given, and the image was cervical vertebra. So the question asks, through which area third part of vertebral artery passes? As you all know, third part of vertebral artery passes through this foramen. This is nothing but foramen transversarium. So foramen transversarium. So this is foramen presence in transverse process of cervical vertebrae. So this foramen transmit third part of vertebral artery, and this is nothing but, this is actually vertebral canal. So this is vertebral canal or spinal canal that transmits spinal cord. Coming to question number 30, compression of which structure causes this visual defect? As you can see, this visual defect is heteronymous hemianopia. Heteronymous hemianopia, also popularly known as bitemporal hemianopia. Heteronymous or bitemporal hemianopia. See the temporal side vision loss in the both eye. So compression of which structures? The options are like optic nerve, optic chiasma, optic tract, or another options I forgot, either it was occipital cortex or lateral geniculate body, something like that. So compression of this optic chiasma causes bitemporal hemianopia or heteronymous hemianopia. So I have discussed question number 21 to 30. In the next video I am going to discuss question number 31 to 40. Stay tuned for the next video. Don't forget to subscribe my channel and share the video with your friends, juniors and seniors. Thank you very much for your attention.